I'm going to introduce you to Mary Aisen. After I was diagnosed, Mary Aisen was the first person I saw who really paid any attention to me. I just fired my GP and my rheumatologist for very much the same reasons that Judy did. And so Mary took an interest in me. She's been working as a physiotherapist with the Arthritis Society for a long time. She's a board member, was a board member, because it's now sort of folded out into the CSA, but she was a board member of the Ontario Spondylitis Association, where she gave us good counsel over many years. She's designed the stretching exercises that are in your handouts today. So Mary Aisen, I'm really pleased to welcome you to our stage.
Are you all ready to stretch? So the title of my talk is Exercise, the Cornerstone of Spondylitis Management, or it should be spondyloarthritis management. I guess I made a typo there. So we're going to blend the stretch break with my formal talk, and hopefully you'll have 10 extra minutes for the latter half of the program. So that's why I've got a clock there. It says 15 minutes. So I need somebody to tell me when 15 minutes are up. Okay, you're going to help me. Thank you. So John is another, if you come around here, there is a step, so that might be easier. And Felicity, if you go around over there, yes. Okay, so for those of you in the back, I know you can't see this, but we have a bed, we have an exercise ball, and we have a chair. So we're going to only use the bed for one exercise because it's too hard for you to see that. So do I have a hand mic that I could use? Thank you. That's great because they might need some help. How's that? Okay. So thank you very much for volunteering to be our helpers. Now, you've been sitting for quite a long time, and before you get up, in order to not injure yourselves, I have a few stretching exercises that I'm going to show you as a technique that after you've been sitting, rather than getting up and saying, oh, you know, it's so hard to get up and straighten up, if you do a few of these exercises, you'll see that it'll be so much easier for you to get up and then get moving. So I'm going to have John, if you can sit on the ball, and if Felicity, you could sit on the chair. Okay, those of you closer will be able to see, and you know, so what I would like you to do, these are the things we're going to be doing today. And you're going to be able to see these exercises on another one of the handouts that's at the Arthritis Society table in the back. So just sitting in your chair, if you just want to stretch your legs in front of you and just start circling your ankles, start to get the blood flowing, circle them in one direction and the other. You can actually straighten one knee and do it with one leg so your ankle has more room to move through a full range of motion, and then you could lift the other leg and do it with the other leg. Great. Next, we're going to incorporate a forward arm reach with breathing exercises. So if you can begin by just thinking tall as you sit there, inhale through your nose, take as big a breath as you can, and then as you exhale, lift your arms up as high as you can over your head, just as you could see in the picture. Great. Hold it up there. Inhale. And as you exhale, bring your arms down. Do you notice how much easier it is to move if you're exhaling as you move? So as you inhale, then exhale as you lift your arms up. Hold it there. Inhale again, feel the stretch, and then bring your arms down as you exhale. Next, this is called the heel-toe lift. So just sitting forward in your chair, if you could bend your knees, have your feet flat, and then keeping your heels on the ground, lift the front of your feet up, Then put your feet down and then lift your heels up off the floor. So it's kind of like starting to march on the spot. So you're just doing, this heel-toe movement. Notice the feeling of your calf muscles stretching. Things are warming up, the blood is flowing, and just think about how easy it is to do this anytime. And finally, we're going to do a leg lift with ankle movement. So if you could just hold your belly in, hold your navel to your spine, lift up one leg to straighten your knee, feel the muscles tighten in the front of your thigh, and then point and flex your foot 5 times. Then put your foot down and do the same thing with the other leg. Great. And let's do that one more time with each leg. So I call this warming up the engine, okay? You put the key in the ignition and you're saying, oh, I'm going to get up. Then you start warming up the engine before you get moving. Well, it's the same with our bodies. So if you could now just lean forward a little bit if you need to. I'd like you to stand up. And we're going to continue with the next part of our exercise routine. And we're going to start marching on the spot, okay? So let's start marching on the spot. We can just pretend we're in London, England. We have people here from all over Canada. I don't think we have anyone here that came all the way from Europe, but I know we have people who have come to Toronto to this program who have moved here from all parts of the world. So if you could just march on the spot, that would be great. Take some breaths as you're breathing. If you need to hold on to the chair for balance, that's perfectly fine. Great. Getting warmed up? Getting warmed up. I know it's a lot easier to walk than to march, isn't it? Okay, and take a big breath. You're feeling warmed up? Are you ready now for some gentle stretching? Actually, you can even I want you to do this gently because you're here, and I'd like you to work and remember to listen to your body. But notice that after you've had this warm-up, you're going to be able to do a little more of a vigorous stretch because your body is warmed up. So now John is going if John's sitting on the ball, maybe you better stand because they're all standing, okay? But if you were sitting on the ball doing this exercise, you'd also be strengthening your core muscles and you're getting a more effective workout as well. But moving your neck, you can be in any position. So if you can stand tall, hold in your belly if you can. Just think about your core muscles. Relax your knee. Pull your chin into your chest if you can. Feel like somebody's pulling you from the top of your head as if you've got an S hook. And from this position, notice that if you can, that you have a double chin. Now, for many of you whose necks are pretty fused, this will be extremely difficult. So please be careful. But from that position, see if you can turn your head to look over your right shoulder. And hold it there as you breathe in. And as you blow out, see if you can go just a little bit further. Now, inhale. And then bring your head back to the center as you exhale. Inhale and turn in the other direction. Try to look over your shoulder as you're exhaling. Then inhale again and come back to the center as you exhale. Great. Okay, so we're not going to go through all of the neck movements. We'll just do one more where you lift your head up and try to bring your head back as far as you can and see if you can look at the ceiling. So we're giving ourselves a good extension stretch. You may feel this all the way down your back, but certainly counteracts sitting at the computer and giving yourself a good stretch. That's great. Thank you. Okay, so let's just go to the next set of exercise. And this is a breathing exercise. Now, I think you might notice that these are the same exercises that are on your orange exercise sheet. So they should be familiar when you look at that sheet for more reminders. So this exercise is a breathing exercise where you begin by rotating your shoulders. Inhale, rotate your shoulders backwards, and as you exhale, reach your arms back behind you. Hold the position. Inhale again, and exhale as you stretch just a little bit further. Do you feel taller? Inhale and come back to the center. Great. Next exercise. Now we don't have a wall corner to do this in, but let's pretend you're standing at the corner of the wall. And I like to suggest to people that you do this in the stalls in the bathroom when you're taking a break at work. You know, you can just be stretching every time you go to the washroom. But how you can do it sitting at your chair or standing is to raise your arms up so you're in the shape of a W and try to bring them out if you can. Great, thank you, John and Felicity. You're really good learners. Okay, so as you inhale, and as you exhale, try to stretch back a little further. You'll notice the stretch between your shoulder blades. Now, keep that position. Inhale, and come back to the center. Inhale, and come back once more. Feel the stretch between your shoulder blades and in the front of your chest. And when you do this one in the corner, you'll feel more of a front chest stretch and relax. Put your arms down, and then you can vary the position. Finally, now this is a hard one. If you want to turn to face the center of the room, and you can hold the back of your chair, or you could put one leg up on the chair. Okay, now John, I don't know, I think you'll just watch Felicity. If you can grab the back of your foot and try to pull your heel up to your buttocks. If you can't reach your foot, because that's a problem, that's when you would use a belt or an elastic band to help you. Or you can, if you see the picture here on the far right, on the number 6, the one on the left side, you could put your foot on the edge of the chair, stand tall, and then try and just bend the knee that's on the floor, and you'll end up getting a stretch in the front of the leg. This is a really important exercise. Okay, relax. A little difficult to do here in the room. Now here's one more, and this one is pelvic rotation. Now if you're diagnosed really early, you may be able to preserve the natural curve of the lower spine. Now obviously, we cannot do this exercise in standing, but believe it or not, you can. If you just think about tilting your pelvis, you know, lifting up the front of your pelvic bone and then letting your tailbone stick up behind you. And if you're sitting down, why don't you sit down now for me? Okay, John is going to sit on the ball. Okay, and as he rotates on the ball forwards and backwards, he can actually be arching and rounding his back and sitting. Okay, are you trying that in your chairs? Now, here's one more. Again, rather than doing it in lying, John can do this on the ball, and you can all do this on the chair. So as you inhale, bring your arms up in front of you. Just in forward, just as Felicity's doing. Have your palms facing each other. Now, I presume you've already exhaled. So inhale. Now, everybody, as you exhale, rotate to the right with your right arm and have your eyes follow your right hand. And come back. Yeah, it's a little hard, but I hope that's helping you. And then again, inhale, and let's go to the left. And Felicity isn't going to hit John in the face. Okay, now if you can hold that position, inhale and exhale and go a little further to the left, a little further, a little more rotation. Okay, exhale and come back to the center. Thank you. Now, I want you to notice that John was getting a really good workout on his abdominals there, trying to not fall off the ball. So, okay, we're on the second half. So I will be asking you to help with some other exercises. So if you just want to turn sideways so you could look at the screen and not miss the rest of the presentation. So the question was, what exercise is the cornerstone of managing spondyloarthritis? And if you saw that Michael's first opening slide, you saw that there was a panel on the left that said that exercise, patient support groups, advocacy, therapies are just as important to collaborate with the medical pharmacological management. So what is the distinction between exercise for health and exercise for spondyloarthritis? Well, we all need to be exercising for our health. And this is a great website, the Canadian Society for Exercise Physiology. They've been writing articles, a lot of press in the newspapers lately, because they've come out with a new set of exercise guidelines for young children. So why is it important? Is because when you have one chronic condition, which many of us have, we have an increased risk of developing another chronic disease like diabetes, heart disease, kidney disease, respiratory disease. So we need to be exercising for our health. And the outcome is, the decision is for people 18 years old and over, is that we should be engaged in physical activity that raises our heart rate for 150 minutes a week. So you can do that in bouts of 10 minutes, or you might want to divide that up into 5 days a week of 30 minutes, but a minimum of 150 minutes per week. We want to be involved in strengthening exercises. That means muscle building exercises that challenge our muscles. Exercises that when you're finished doing the exercises, your muscles should feel tired. And then on the day that you're not doing the exercises, the muscles are healing and actually strengthening on the resting days. So strengthening the same muscles day after day is overdoing it. If you like doing your strengthening daily in your routine, then strengthen the upper body one day and the lower body another day. And the result of this is that we will all be able to have a 50% increase just with that effort of having better fitness, more strength, and improved mental health. Now, what about exercise for spondyloarthritis? Where is the distinction? And as Michael said, he likes the word, wanted to be sure that I talked about therapeutic exercise for spondyloarthritis. So all exercise is therapeutic, but what's important for spondyloarthritis? Well, the first thing is the posture, and early diagnosis can result in having normal posture living with spondyloarthritis, because early diagnosis, better medical management, but also awareness that you really have to be fighting the desire of gravity to push us forward. So I talk about a posture check on a regular basis and then a posture stretch as a formal part of therapeutic exercise for spondyloarthritis. So sitting in your chair, just think about that right now. Just think about your posture in sitting, where you hold your navel to your spine. Think about your ears being closer to your shoulders, and just feel tall. Feel that between your shoulder blades there's an egg there. You don't want to grip it so hard that the egg's going to crack, but you don't want to let go of it so the egg doesn't fall to the floor and crack. So that's a little, visual help to get you focused on that movement. Then breathing exercises. For many people with spondyloarthritis in the early stages and with the enthesitis-related arthritis, which children have a lot of, as Dr. C was speaking, and that people may have cartilage involvement where the rib cage is attaching to the breastbone. It's hard to take a breath. It's important to really pay attention to deep breathing. Spending time on it in the morning and the evening will help you help you in the morning to loosen up a little faster, may help you to relax better for going to sleep. And take time at mealtime and at break time to really pay attention to deep breathing. So how about if we do it now, okay? I want you to just, if everyone can put their hand on the front of their chest, okay? And as you inhale, try not to move your shoulders, but feel your upper chest lifting up and away from you, like in a 45-degree angle as you inhale. And feel your belly round out. And then exhale and feel the chest fall and the belly pull in. This way you're getting a stretch of the anterior chest. You're by letting your belly round out like a balloon. You're allowing the diaphragm to come down and to get as much excursion of the lungs within this painful rib cage. Okay, let's try it one more time. This time, put your hands at the side of your chest wall. Like just at the side here. You may want to do it this way. If you're a little stiff, you just put your fist on the side of your rib cage. And think tall, but as you inhale, let your belly roll out like a balloon and feel the chest wall pushing out against your hands. Try to feel some pressure that your side of your chest is expanding. And relax. Okay, and one more with your arms at your side, elbows tucked in at your side. Yeah, John, you can bend your elbows. Bend your elbows, yeah. Now John's going to do it with the elastic band between his hands. Grab the elastic between your hands, around, just hold the elastic in your hands. No, off your neck. Great. Okay, roll it up. There you go. Thanks, John. Okay, now for all of you, as you inhale, just inhale, and as you exhale, try to move your hands away from the center and feel your chest wall expanding. And then exhale, yeah, I don't know where you're at. Exhale, but then again, now bring your arms back to the center, okay? Try it once more. Inhale, bring your arms out away from your body, hold it there, and exhale, and hold them there 1 minute longer, 1 second longer, inhale, and see if you can go a little bit further, and you can just help your chest wall expand. Now, with John using TheraBand, that's a strengthening exercise, but that even challenges your chest wall muscles even more and strengthens you for good breathing exercises. So now we're going to talk a little bit about strengthening. I just showed you that. There you go. We're already ahead of the game. Now, with John, Felicity, if you could stand up, face John. John's going to stand up. And I'd like you to hold the elastic from the center. Pull it in, and you be the holder of the elastic in the center. Okay, John's going to be the holder of the elastic. Okay, so if you have exercise elastic at home, you can attach that to your doorknob. Or if it's fun, you want to work with a family member and you can play together. Now, Felicity, if you can just pull your arms back and feel the resistance of the elastic. Stay tall as you release the elastic. That's right. Okay, so you can be doing this here as well in your chair. So pull back and relax. Now put your arms down by your side, and this time the strengthening is going to go from the back. Pull back. Pull back. There you go. Look at the strengthening. Strengthening the back of the body, the back of the arms is important as well. Okay, so we're going to carry on. I'm almost done the presentation. Remember, with spondyloarthritis, you want to warm up before vigorous stretching, and wear all over, in the gym, in the pool, at yoga, Pilates, Tai Chi. You can call the Arthritis Society to get help. It's free. And the Arthritis Society table at the back has more information. We run some exercise, group education, and you can sign up if you want. There are some sign-up sheets out down there as well. You can get more information on the internet. And remember what people have said about advocacy. Advocate for your rights as people with arthritis, and consider joining the Spondies team. And I hope you agree that exercise is the cornerstone of spondylitis management.